Hi everybody, it's Melissa from Aim at Melanoma coming to you live on Facebook to talk about doing a skin exam. So, what do we need to know? First of all, I just want to kind of clarify that not all melanomas are identified on the skin. There are people who develop a melanoma that do not have a primary, do not have a skin primary. You still want to do skin exams on yourself because it's important. Everyone should be doing it after they hit puberty. We can do skin exam on our children if we want to. It's partly the healthcare provider's responsibility to check your skin and partly yours. So I am hopefully by the end of this little 15-minute or so segment going to make you feel a little bit more comfortable about how to do a skin exam. The reason that it's so important is that you know your skin better than anybody else. You see it every single day. And actually, vastly more people identify their own melanomas or skin changes that are atypical than healthcare providers because of that reason, because you see changes in your skin. Plus, we may be only seeing patients every 3 months, every 6 months, every 9 months, every year. So in the space between when you're seeing a healthcare provider, it's very important to be aware of your skin and making sure that you check everywhere. So we're going to talk a little bit about that. One of the other things that is part of a skin exam, and this goes back to people that don't have a primary melanoma, is checking your lymph nodes. I'm going to show you how to do that quickly as well, because that's also important, because the most common place that you find an unknown primary, at least in the academic setting that I work in, is a lymph node that's enlarged that you get biopsied, you find out that it's melanoma. Now that doesn't mean that you can't get an unknown primary melanoma somewhere metastatically, but these are the things that you can follow to look for yourself. So that's why we're going to kind of focus on cutaneous melanomas and changes in the skin and changes in your lymph nodes, because that's something that you can do on your own. Now, at the end of this lecture, you're not going to be able to diagnose your melanoma, most likely. That's not the goal of this. The goal of this is to help you recognize when things are wrong and tell someone about them. I can't tell you how many times patients come in and talk to us about, oh, I saw this on my skin, it looked like it changed. My sister told me I had something on my back. That's so very helpful, and you know your skin, and we trust our patients. So keep it up. The first thing I want to talk about, and I'm going to put a screenshot of this up on the website after I'm done, are the ABCDEs of skin cancer. This I got from actually our office. But what you can see is the things that you're going to look for. You're going to look for asymmetry in your mole. Forgot I have to point with my other hand now. You're going to look for the borders. See how the borders in here are scalloped and kind of not regular. It's not a round one. You're going to look for color changes. Now, it could also be this dark area, but it also could be light. Whenever a mole is brown and then all of a sudden parts of it are pink or whiter, that's actually a sign of regression. So that means that the melanoma is the color is being pulled. I'm trying to make not a glare. There we go. D is for diameter. Any mole that's greater than 5 millimeters, which is like a pencil eraser size, is considered to be atypical. And E, which is the most important one, a lot of times is evolving. So moles that have any one of these other characteristics that are changing. So you had a mole on your leg, arm, stomach, whatever, for many, many years, and then all of a sudden it started to get darker, it started to grow, or it started to become raised. Those are all reasons to tell your healthcare provider that something's wrong. So A, B, C, D, and E, evolving, are all the important things. And again, I'm going to take a picture of this after I'm done, and I'll post it in the comment section so that you can see it. One of the other things that we want to do first, I always like to look in my bathroom. So things that are important. You want a well-lit place so you can see really well. You want to make sure that you have a mirror, because you can't usually see your back without turning your head all the way around, and luckily we have bones and muscles that keep that from happening. You want to make sure that you have a camera. I like to tell patients that if you find something that is atypical on your skin, take a picture of it. Almost everyone has a cell phone now or a camera of some sort that you can take a picture of. I like to try to tell people to use a measurement tool of some kind on the picture. So like you have a tape measure, it doesn't have to be like this, rulers, whatever. You want to put it up against the mole that is atypical and take a picture of it with the actual lines on it so that you can see if it grew. If you don't have something like that, you can use a penny or a dime or a nickel or anything that, you know, you can sizably see a difference in. And then just take a close-up picture. Those are some of the important things that you want to have. Obviously, when I do my skin exam, I do it once a month. You don't need to be looking at your skin every day. Pick a time, pick a date. With women, they should be doing breast exams. Pick a skin exam day. That way you won't forget. But when you get in the shower, a lot of people do things like that anyway. I like to do my skin exam, obviously, without my clothes on. Can't do that on live camera. So I have shorts and a tank top on just to kind of show you like the areas that we're going to look at. So we'll start at the head. I put my hair up like this. No one's going to go through your hair completely, and it's really hard to see the back part of your head. Your healthcare provider can look through your hair, your hairdresser can look through your hair, your PCP, whoever it is. But you want to just kind of look at your scalp like this. So just separate your hair. Some people find that using a hair dryer helps separate the hair. Some people use a comb. The most important thing for like you to be doing, because this is the place that gets all of the sun, is to actually look like along the hairline where you can see. And then I look at my face as a whole. So look at it. Does something stick out to you? That's called the ugly duckling. 90% of the time, the ugly duckling mole is the one that is atypical. So you want to look and see if there anything that sticks out, whether they're red spots, brown spots, black spots, anything. I always actually tell patients to like look at the whites of your eyes to see if you have any freckles or anything like that. I look in my ear, so check both the inside, and then you're going to need a mirror most of the time to look at the back side, checking all of here as well. You want to look at your neck as a whole. So you have a little skin tag here. That would be something that sticks out. And then I look at my chest. When you're looking at a hand to check for moles, you want to make sure you check in between all of your fingers. You can get pigment in there. When you're looking at the nail beds and things like that, you want to make sure that you look both at the nail bed for something that would look like a mole, but also streaks in the nail or discoloration of the nail, or lifting of the nail, ridges, things like that, because those are all warning signs that something is not exactly right. There's my screwed up thumb that I cut off. And then, so let's, as an example, I'm going to try to use the wide angle lens. So just hold on one second. Okay. So as an example, if I was looking at my arm, I would notice, oh, I got to remember that I'm backwards. I would notice that, here, wait, let me move back a little bit. We'll do it this way. Ugh, it's hard to be backwards. So if I'm looking at my arm, I'm going to say, okay, this guy is the one that sticks out. It's atypical. When you look closer at it, you can see that it does have variation in pigment. That's actually something called a seborrheic keratosis. It's really hard to tell the difference from a layperson between keratin and nevus. So don't worry about that. But if I were to go to my dermatologist or healthcare provider, I would circle that because that's atypical. So what you're going to do is you're going to look like from here to here, pick out the atypical moles. From here to here, pick them out. I usually do like my chest here as a whole, then my stomach. And then you're going to do like the front of your leg from your knee to your hip on both sides. And then once I finish like the front half of me, then I usually get my mirror out and I'll look at the back side. Now, when you're looking in the mirror, it's harder. This is where you get a friend to help you. Say, hey, do any of these moles on my back stick out? If you're looking at the mirror, if this is my mirror, I looked everywhere in my house to find a mirror. I could not find one. So you look in the mirror, you're going to look this direction to try to reflect and see if you can see anything. But honestly, find a friend to look at your back, or your husband or your kid, whatever. They will definitely be more than willing to tell you if something is atypical. You just want to make sure that you're checking everywhere. The other places that are important are to look under your feet, on the bottoms of your feet and the soles and palms of your hands, between your toes. I know girls a lot of times like to have pedicures, take the polish off every once in a while and check the nails, check the nail beds to make sure that there aren't any streaks or anything like that. The other places that don't typically get looked at on a self-skin exam are your belly button. You are going to need to look at your genitals. You can get a cutaneous melanoma or discoloration there as well. Look between your butt crack. Personally, if you've ever had a skin exam by me, you know I look kind of everywhere, but no one's going to do the exact same skin exam. And that's why it's important for you to be your best advocate and look on your own. The other places that you want to look are inside the mouth, like this, on your cheeks and your gums, on both your upper and lowers. Look at your tongue, look under your tongue, because you can get melanoma there as well. You're not going to be able to look every place, but if you're vigilant about your skin and know when it's changing, that is so, so important. Some other things to keep in mind when you're looking for skin changes: it's oftentimes really difficult for your healthcare provider to diagnose things by pictures. So it's very important to consider, if you find something, take a photo of it so that you can identify where it is, so you can watch it over time. But note that really the best way to diagnose is in person. So if you send me a picture of a skin lesion, I'm happy to tell you, hey, that looks worrisome, you should go get it checked out, or explain a little bit more of what it is or could be. But really diagnosing things via camera are not very accurate. So make sure you're getting a regular skin exam at least once a year. Okay, so to check your lymph nodes. Lymph nodes happen kind of everywhere. So I'm going to move away from the camera again. When you're looking at lymph nodes, basins, you're going to look here on your neck, because you have lymph nodes on the front and the back of your neck. You have them in front and the back of your ears. You have them underneath your armpit. You have them in your groin, behind your knee. You have them really everywhere, but those are the best places, or the most concentrated areas of lymph nodes. They're actually lymph node basins. They're sort of like the main hub of a train track. The best way to feel a lymph node is to make sure that you're soapy. It's kind of similar to a breast exam. Like, let's say we're going to look at my or feel my under my armpit. I'll be hopefully soapy. You just literally want to run your hand under the crease, down here at the bottom, up on your arm, because that's part of your lymph node basin, and then on the front part, which is actually part of breast tissue as well. If I were going to do my neck, I would just run my soapy hands like this, down the front of my neck, over top of my clavicle on both sides, and then on the back of my neck. Now, the key is not to push too hard, because if you push too hard, you won't feel it. But when you're soapy, it actually makes things a little bit easier to glide your hands over and feel. But what does a lymph node feel like? It's basically hard. It's round. A lymph node that is atypical will feel more like a marble or a grape underneath the skin. If it's squishy and movable, it might be a salivary gland. But it also could just be a chronically enlarged lymph node from having allergies or having a pimple on your face or something else like that. But if you feel a lump where you're not supposed to, get it checked. It's very, very important. I have just a couple of comments. I was just trying to look. Oh, basically you're just telling me all about yourself. I like that. That's a good thing. If you have any questions or want to know a little bit more about how to do a skin exam, or you don't know where to find a person to do a skin exam for you, please reach out to us. You can reach me by the 1-888 number or 844 number. There's a link on the website. You can email me. Again, send me pictures. Anything to help. The most important thing is making sure that you are very, very aware of what's on your skin and how it's changing. All right? Thank you for tuning in, guys. I really, really appreciate it. Oh, Linda, spitzoid melanoma. Basically, a dermatologist or at least a very skilled healthcare provider is going to differentiate between spitzoid melanomas. But honestly, spitzoid melanomas look just like regular melanomas on the skin. It's pathologically that they're a little bit different. So no matter what, get it checked. Okay? Thank you for tuning in, guys. We'll see you next time.